Are you trying to determine how to budget for healthcare costs in retirement? We can help.
We're Shannon and Michael. We're with Healthcare Genius, and today we wanted to talk to you, like Michael said, about different ways that you can budget for healthcare in retirement. So believe it or not, healthcare is one of the number one concerns that people have when they're thinking about retirement. How am I going to pay for healthcare? How do I even know how much it's going to cost? Healthcare is actually one of the fastest growing spending categories in general. It's only beat out by education, but the costs are getting higher and higher, and it's happening really quickly. And the older we get, the more we spend. So when we think about retirement, we're going to be consuming more healthcare, we're going to be paying more money for it. And so today, again, we're going to talk to you about some of the different ways that you can prepare, some of the best ways that you can pay. So first, number one, HSAs.
That's exactly right. Health savings accounts are really the best way to save for healthcare costs. Why is that? Well, they're tax deductible, they grow tax deferred, and you can take the money out for medical costs tax-free.
And you can only contribute up until age 65 or up until you start taking Medicare, sign up for Medicare. But you can actually take money out of those accounts really at any time. There's a cap to how much you can contribute, but however much is in there, you can use on healthcare costs. But what we always tell people is if you can, don't touch your HSA until after you retire, because costs will be high then, and at that point you can't contribute any more money. So that's when that money is the most valuable for you. Plus, your money can actually grow in a health savings account, similar to how it can grow in like a 401k or another kind of retirement account. So leave it in there for as long as you possibly can, because you're going to need it when you get older.
And the younger you are, the better off you are too, because you can give that time to grow. So that's really good. A couple of other accounts that are like HSAs, but they're a little more limited. One is what's called a 401h account. That's designed to be used inside of defined benefit or cash balance plans. Mm-hmm. In those plans, they can also set money aside for healthcare costs that can then be taken out by employees tax-free to pay for healthcare. Now, these are employer contributions in this case, not like the HSA where a lot of times the employee is contributing. But 401h's are also excellent ways because, again, they're going to be tax-free when it comes out to pay for healthcare costs. And then VEBAs, Voluntary Employee Benefit Associations. Not a lot of companies do that. We do see a lot of governments across the country have those plans. Mm-hmm. They are very much the same way, although they allow contributions from employees. And again, for healthcare, they can be taken out and pay for healthcare costs. So those are the three best ways to budget and to save for healthcare costs when you're going to be retired.
That's right. And they're the most tax efficient ways. If you have an employer that contributes to your healthcare and retirement in any way, absolutely take advantage of that. Again, you'll need it. Next, we are going to talk about kind of the next tier, which is life insurance.
So cash value life insurance is another tool that you can use to pay for healthcare costs in retirement. If it's designed properly, you can begin to take loans or distributions out of policies. Those are tax-free in a lot of cases, and you can use those to cover the costs. Also, we talk about this a lot in our videos. There's these new hybrid life insurance policies that will help you cover long-term care and or medical expenses if something bad happens. So not only do you have the cash value that you can access, but you can even access part of the death benefit to pay for healthcare costs if you have cancer, heart attack, stroke, or if you have a long-term care event. So we look at those as another great way to be budgeting and saving for healthcare costs. Go into ROTH. ROTH accounts are not quite as good as the HSA because you have to pay taxes on them today, but down the road you have the ability to take money out of those plans that are tax-free. And so, again, they can really help cover the costs of your Part B premiums, your out-of-pocket costs, your Part D
That's right.
premiums.
And there are limitations on Roths in terms of how much you can contribute, how much you can take out.
That's exactly right. When we talk Roth IRAs, a lot of higher income individuals are excluded and can't contribute to those. But if you have a 401k option at your employer and they offer Roth, those are great ways to be thinking about putting money aside and budgeting for healthcare costs.
Absolutely. And the younger you are, the bigger opportunity there is there.
Another way that we see people potentially using a tool that they use for paying for healthcare costs would be single premium immediate annuities, where they take a lump sum of money and they turn it into a guaranteed income stream for the rest of their life. If it's after-tax money, a lot of those dollars will be tax-free. Not all of it. We call it an exclusion ratio. But a good portion of that could be tax-free because you've already paid taxes on it. So that's another way. Annuities aren't always the best way to pay for this, but that happens to be one. Certainly also annuities that are inside of a Roth qualified account can work for paying for healthcare costs. But these are some of the tools that you can use to budget and really plan for healthcare efficiently. We talk about that all the time. You want to be efficient when you're retired. You do not want to be paying taxes and using after-tax dollars to pay for health care.
That's right. And the thing that all of these solutions have in common is that they are a planning tool. There's something that you can do so you know the money's going to be there when you need it. There's a misconception out there that we'll have no idea what we'll pay for healthcare costs in retirement. We just know it'll be a lot. That's actually not true. There is a way to figure out how much you likely will pay, and we've actually developed a tool so it's an easier way to calculate that. It's what we call our crystal ball, and it'll tell you how much to expect to pay for healthcare costs in retirement. You can go ahead and check that out in the link in our description below. It'll ask you a few questions and we'll send you a report totally free. It's our number one priority to educate people on healthcare costs in retirement. When you know what to expect, then you can start planning.
That's exactly right. I mean, when you think of budgeting, you can't budget for something you don't know what it's going to look like. So definitely take the quiz, get the report, so you'll have an idea of what your specific costs are going to be.
Absolutely. If you have any questions about any of the strategies that we talked about, go ahead and leave us a comment below. And if you haven't already, subscribe to our channel and click the notification bell so you know when we come out with new videos. Again, we're Shannon and Michael with Healthcare Genius, and we are here to help.